Okay, let's pump ourselves and our thoughts with positivity. Oh my god, blah, blah, blah. And let's turn off for a while the negative thoughts. Feel better and happiness in your mind and your heart. Don't forget to subscribe, like, and click your bell button so every time I make a video or post a video, you get notified. Follow me as well on Facebook and Instagram as Eliza Paulson. Without any further ado, let's dive in our topic so we can talk about it and I can share with you my tricks and tips during my tumor radiation on my head. After you had your initial appointment with your radiologist, you can ask a bunch of questions, anything, but I recommend that you should do your own research first. In anything that you do or anything that you ask, you should do a thoroughly research about anything, so you can have a clear questions and answers from your doctors if you want to know anything about what you're having, your treatments, side effects, or whatsoever. But anyway, here's the thing: when you go on your radiation, anything that you do before you go and lay down on the big table and they put you on the machine, they will ask you a couple questions, and then the radiologist crew will adjust or do something like numbers that they follow from the doctors, and then you're gonna start your treatment. So here is the tips and tricks that I've learned during my radiation on my head. When you lay down on that table, and you will find or you will hear different noises on the machine, but they will warn you anyways though. On the radiation that I did, I only heard two, actually only one, and then the second sound was totally silent. So here it is. When I had my radiation on my breast 2 years ago, no, last year, 2019, when I had it, it was different. It didn't really even bother me. Well, it's the same. You get exhausted, you get tired, you get fatigue, whatsoever. But this time, it is different because you will taste a little different, and it's so wow. I'm not gonna say it, but it's disgusting. It's disgusting. Seriously, I'm not kidding. On the first day that I had my radiation, I did not know what to expect, but I am always try to observe anything around me, anything that is happening, the sound or whatsoever. So what I did on the first day, I just let it be. Whatever I feel, whatever happens, so be it. On the second day, I have learned from the first session, when they warn you that they're gonna start the radiation, the treatment, the first ever sound that you're gonna hear, I did count 27, 27, like buzzing, buzz, buzz, buzz. 27 of those I counted, and then a silent, dead silent, and I counted another 12 or 15 counts. And then you will see, if you close your eyes, you're not gonna see it, but you can, I don't know, because mine, when I was lying on that table, I did close my eyes, but not thoroughly close like this, like there is a little gap. And so after counting the 27 count on the first buzzing and then a dead silent, I counted 15. When you count the 15, like counting 1 1002, 1 1003, something like that, I counted after 15. Hold your breath and don't swallow any saliva that's on your esophagus or in your throat. Trust me, you do not want to breathe, or just hold your breath maybe for 5 seconds, because if you don't, you will taste the yucky, I don't know why, but you're gonna taste something so yucky and you would not want to have it. And I would suggest, when you go in, before you go in, if you have a lemon ginger or lemon honey candies, try to have that one in your mouth. After you count the buzzing 27, after counting 15 counts with the dead silent, hold your breath for 5 seconds, swirl your candy in your mouth, and hold your breath. So you're not gonna taste and you're not gonna smell the yucky thing. I asked the radiologist crews if they even had any questions or comments from the patients that has been doing their radiation. But this is, I don't know specifically if this is specifically from when you're having your radiation on your head, because when I had it last year on my down below, it's not, I didn't taste anything, but I always have a candy in my mouth. So that will help a lot. I always kind of share with them that they should tell something or share something with the patients. And as well, when I go out, and if there's any patients outside and waiting for their turn for the treatment, I always talk to them before and after, something like that, something to share, because it's not it's not an awesome feeling, and it's not either, it makes me still like, mm, it's not a good feeling, it's not a good taste, and trust me, it's not good at all. This video might work with you as well, with the tricks and tips that I had when I was having still my chemotherapy treatments, and it might help you. If not, maybe some of them will help you, and maybe you can share it with your loved ones or your friends that are going through the same treatments. Please, please, please be diligent to do your own research, your observations, and anything, because what I'm sharing with you, it is totally based on my experience and observations during any treatments that I go, and I always do my research as well. What are the questions I should ask? Or you can ask some patients around the area in the clinic if you wanted to, if you're not shy. Well, don't be shy, because you guys, we are doing the same treatments, and maybe they would want to share or whatever experience they had, or give you some advice or tips and tricks. So yeah, don't be shy, because it's for our own sake. And I am not a doctor. I did not finish school for PhD or anything. So please, please, please do your diligent research for anything. Don't forget to comment below if you have any questions, or if you have any recommendations, or if you want to share any suggestions. If you have any feedback, please, 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 please send me a shout, send me a DM in my Facebook or Instagram, or you can just comment down below and I will respond as soon as I see it. Don't forget to subscribe, like, share, and push your bell button. And remember, keep fighting, keep your spirit high. Don't be afraid to do your prayers all the time, and always, always entertain the positivity. So this heart and this mind are entwined together. Don't forget to smile. Keep smiling, all right? Have a great and wonderful day.